Hello and welcome to another episode of the PA Path Podcast. Before we get started, we would like to extend a special thank you to our episode sponsor, the PA Education Association. Today we speak with Dr. Susan White, Program Director for the Boston University Chobanian and Avedisian School of Medicine PA program, as well as PA Stern, their Associate Program Director and Director of Didactic Education. Dr. White has been involved with the program since 2013 and PA Stern since 2016. The program received continuing accreditation from the ARCPA in 2018 and is well on their way to making a name for themselves in the Boston area. Susan and Aliza, thank you so much for joining us today. We're excited to learn about you and your paths to getting involved in PA education, but also about Boston University. I had lived in Boston for many years. It's a very impressive institution. It's delightful to see them bring on a PA school there. And so I know our audience will be excited to hear about it as well. I'll start with Susan, and then Aliza, if you could take this question as well. Susan, can you tell us a little bit about your path to getting involved in PA education? And for Aliza, we'll ask about your path to becoming a PA.
Sure. So I was an OBGYN. I'm an OBGYN board certified, and I was practicing in New Hampshire when one of our medical assistants joined the then starting program in New Hampshire, in Manchester, New Hampshire. And I was asked to help out being an adjunct, just teaching women's health. And I did that for a number of years. And then things changed, and I was looking for something a little bit different to do. And they were looking for a full-time faculty member. So I decided, sure, let's try this. So I joined there, and then I stayed there for 7 years. And then I came down to Boston University. My kids had grown and were off to college. I could do something different.
Thank you. And then Aliza?
Sure. I feel like my path to being a PA was probably very similar to most people, I think, who go into being a PA. Originally, I thought I wanted to be a physician. And then as I started exploring what that entailed, I heard about the PA profession during undergrad, and I thought that was something I'd work for. After undergraduate school, I went and worked for a few years in the medical world and then ended up applying to PA schools. I went to PA school and graduated and went into women's health as well. I did women's health here in Boston, actually at the Cambridge Health Alliance. I should say Cambridge, not really Boston, but Boston area. And I did that for a few years. And I started becoming more interested in other fields as well, including fields that didn't have nights, which I found to be very hard. And I ended up deciding to do a field where I could see patients and see them back and have a little bit more continuity of care as a provider. And so I ended up going into dermatology, which I've been doing for the past 17 years. And about 7 years ago, I started to miss the educational part that I was involved in when I worked at a hospital, and I was precepting PA students and medical students. And I saw that there was a position open here at BU, and I applied for it and entered in the field here and was still able to work 1 day a week clinically and able to do that through Boston University dermatology and then continue on in the program. I started off on the clinical side, and now I'm in the didactic side of BU's PA program.
I thought it was really interesting that you both have women's health backgrounds. From a PA perspective, it's not a specialty where PAs are broadly utilized, I would say. I'm interested in hearing from the two of you how you connect around that and how that influences your curriculum, and maybe some thoughts on women's health and PAs and women's health.
I think, and Susan can attest to this too, because she's had experience with PAs in OBGYN. For the hospital that I was hired at Cambridge Health Alliance, they have residents, but their residents are strictly were in gynecology and not the obstetrics part. So the role of the resident that often would be working with the attending, helping with covering shifts and having extra hands, that was lacking. And so they developed having PAs as part of the OBGYN team there to cover the gaps that often residents will provide. And so I think that's why in the beginning, it was one of the earlier hospitals that I think in this area that used PAs in that manner to fill that gap. But I know, Susan, you had experience as well when you were in training, right?
Yeah, actually, I've always worked with PAs. There were 2 PAs in my residency program at Tufts, which was, I think, probably very unusual. And then when I moved to New Hampshire, we had nurse practitioners, nurse midwives, and PAs in the OBGYN department, as well as scattered in other places like family medicine and surgery and that sort of thing. So Less than 2% of PAs are in women's health, so it's unusual, but the Cambridge hospital model is really great because the PAs are really integrated into doing labor and delivery.
And I think they're starting to use them more now, especially with the limits on call for residents. I think other hospitals have been recognizing that we're a great way of filling the gap so they can stay within their time limits of how many hours they're doing a week, and yet have somebody who's still covering those time gap as well as the expertise. I know even from when I started at Cambridge Health Alliance, I know Beth Israel uses PAs as well now, and St. Elizabeth's here also in Boston do.
Yeah, and we've seen more come into even doing OBGYN floor type care for hospitalist type care at Boston Medical Center to help the residents as well.
Yeah, in my experience, at least, we always have a large number of students who come into PA education with a big interest in women's health and OBGYN. And they're oftentimes really disappointed to learn that there aren't more clinical opportunities for them. So what would you say to current students or prospective students who have an interest in, and I think it's also a way that we could really address some of the preceptor shortage that we had. I think a lot of programs struggle with preceptors in the area of women's health. And so if we could get more PAs working in women's health and OBGYN, it would certainly be helpful for us to expand our preceptor workforce in that area as well. So what would you say to prospective or current PA students who are interested in working in women's health, and how to maybe advocate for that to be a position that might be opened up to them?
I think a lot of those have been traditionally covered by nurse practitioners, and yet the PA model is very different in terms of training. I like to have students emphasize the fact that they're trained in the medical model, that they're trained to do critical thinking, and that they have, rather than just concentrating in one area like nurse practitioners do, they have a really broad experience. And so they can assist in the OR and they can see ambulatory patients and stuff. So I think it's important for them to educate the people who might hire them.
Yeah, I was going to say too, building off of what Susan said, I think the surgical skills that PA students learn make them really valuable in OBGYN field. Everything from assisting in C-sections to hysterectomies to in-office procedures, I think makes us a really good addition. When we have students who come to us who tell us when they graduate they want to go into women's health, not just celebrating it, but also talking with them about exactly what you said, that it's still not the broadest, there's not as many opportunities as maybe some other specialties, but going into specialties that involve surgery or even just family medicine will give them experience so they can build on that. And again, one of the wonderful things about our profession is being able to switch fields. I even found for myself, having OBGYN experience that had surgical experience made me more attractive as a hire in dermatology because of that surgical experience as well as the experience with women's health.
I experienced as an internal medicine PA in the outpatient setting. Yeah, I was actually astonished. I was in an all-male practice, all male physicians and one PA. But I was astonished how many women still preferred to come to us for their women's health versus trying to get in to see a specialist in the community. And I think that's largely because of access and relationships.
Having a great knowledge about all the forms of contraception that are available nowadays, so that even if your practice doesn't do that, you're aware of what options for your patients. And that's a really time-consuming to do that counseling, but it's a great resource for the patients.
I've also seen a lot of programs really dialing up trauma-informed care, particularly around this topic. It's incredibly important. I wonder what your program is doing around that concept.
Yeah, we have started to look at doing that and stuff. I think one of the interesting things about where we are is that we are right next door to the largest safety net hospital in New England, Boston Medical Center, which really has a mission to provide care for any resident of the city of Boston. And so that's a vastly very diverse population, including lots of refugees and immigrants and people who may not have had the kind of medical care that we're fortunate to have here in the United States. And so we've started working on it from the very beginning, taking histories that are culturally sensitive and trying to understand where patients are. I'm sure Aliza's had the same experience. We take for granted that our patients will understand things like picking up refills at the pharmacy, And yet I'm always amazed when I get messages from the nurses saying they need another prescription. I'm like, but they have 11 refills. And just a reminder that in many countries, that's not the experience that people have or the understanding that they have. Yeah, I think trauma-informed care is really key, and we're working on trying to make ours a little bit better too.
That's great.
The course that we recently started this year, our course we really target on, it's our SCORE course, and we focus on vulnerable populations. And one of the things that we feel like is really helping our students to treat these populations, especially the one that our partner hospital sees, is really introducing them to these patients, from everything from trafficking to veterans to LGBTQ+. So we think giving them kind of that base, that solid foundation of understanding the patient and where they come from will make care something that will be a lot easier to do.
Yeah, I completely agree. Let's learn a little bit more about the Boston University Chobani and Avedisian School of Medicine.
Sure, yeah. So we're a young program. We started in, our first class graduated in 2016. But from the very beginning, one of the things we've done that makes us, I think, unique is we have a model where our students do the majority of their learning in basic and clinical sciences during the didactic phase of the program with the medical students. They're in the same class with the medical students. They take the same exams, have the same experiences, and that sort of things. The medical school does have its own separate courses that they do. They call it the doctoring curriculum. We have the PAing curriculum, if you want to call it that. So we have our own separate courses, but the majority of the basic sciences and clinical sciences are a co-educational model.
We recently had a curriculum shift where in the past our students actually started off on their own with some of the more basic medical science courses. But starting this August, now our students day one start class with the medical students, the first year medical students. And in this course, they're working together and they're on teams with the medical student. And the new curriculum focuses a lot on team-based learning. And that, I think, gives them a really great opportunity to start from day one, learning with the population that they're going to be working closely with, and by population, colleagues. And I think it's been interesting to see this class and how they've really enjoyed this experience and how well they've been doing with performing alongside the medical students, taking the same exams as them and sitting in class with them. They've really kept up with them. So we've been really proud of this class.
I think going forward, that fosters a really important kind of interprofessional relationship with physicians and PAs, and how there's mutual respect for the foundational knowledge that both professions have.
Right. And I think it helps both groups of people understand each other better and work together better.
Yeah, absolutely. So tell us about applicants to your program. What might you say to applicants who are thinking about your program and are interested in pursuing a seat? Are there particular things that you look for in an applicant, things that might help set them apart from other applicants? What are some of the unique qualities you're looking for in potential students for your institution?
I think one of the things, especially because our curriculum, because of the real emphasis on team-based learning and flipped classroom, we really are looking for people who are going to be motivated self-learners. They may not have had this in undergrad, and so this may be a new style of learning, so we don't expect them to have that experience, but we do want to see that there is this motivation to learn and to be a self-starter. I think that's a big thing with this new curriculum. Also, the other things, I think it doesn't necessarily make us different than other programs when we look for someone who has the baseline of empathy, as well as someone who has the maturity. It may not be somebody who's had a certain number of hours of medical experience, but we look at them holistically to see that there's someone who does exhibit maturity, as well as being a team member, playing well with others in the sandbox kind of thing. And I think having a strong interest in these vulnerable populations that we really make part of our mission in educating our students. We want to know that's something that they have a strong passion for as well.
I noticed on your website that you offer 3 electives for rotations, and you also have the Cambridge Health Alliance interprofessional care clinic experience and also the option of a longitudinal rotation experience. Can you talk a little bit about that phase of your training and what that has brought to your students?
Actually, the project started, the longitudinal thing started many years ago when I worked with a PA, and I did we're gold scholars to the Harvard Health Professions Education Program. And that was our project, was to work on developing a longitudinal rotation experience. I think it's a great opportunity for students to really see what medicine is like, particularly in a place where you start to get to know people. So that was one of the joys of practicing in New Hampshire, is that I really loved the fact that I got to know the community and people in the community. And some of my patients coached my kids on softball and soccer, and that was actually really fun. I thought it was important for students to figure out what is it that makes you happy and how it would be to practice in a community-based setting. And Aliza's been directing the program since we started it here.
When we decided to work with CHA on it, Cambridge Health Alliance, the two providers, a physician and an OBGYN physician and an OBGYN PA, they had reached out to me here at BU because of my previous working there. And we were really excited to give our students the ability to have 6 months in one system where they could actually get comfortable with the electronic medical record, with the lay of the land, with the schedule, as well as building relationships with their patients too. So they were able to see a patient maybe in the first month that they start this rotation and follow them through the 6 months. And one example that we use is our patients that they would see for the OBGYN part. They would follow them maybe with their prenatal care and start seeing them prenatally, and then they would carry a pager. So when it was time for them going into labor and they were admitted, they would get paged and be able to come in and experience this patient going into labor and having their baby as well, which is an amazing experience for a student as well as for the patient to have this one person that's been with them through the majority of their pregnancy or their medical journey. And it's definitely a challenging 6 months for them because they're not just focusing on one rotation at a time. They may have Monday morning, they may have their women's health clinic, and then Monday afternoon, they may have to go over to another clinic where they do their pediatrics or family medicine. So it's really this continuity of medicine, the way we use the example, the way students in elementary school or even high school, they don't just have 1 month of history and then that's it. They do history the whole year around, and it's the same idea. So it's really giving them these subjects. It's giving them the ability to learn it over a longer period of time. Therefore, it sticks with them better, too. So there are many reasons why I think our BU as well as CHA saw the value in this type of rotation.
Yeah, that's an incredible experience. I'm sure your students really value that a great deal.
Probably more than half of the students that have actually participated in this rotation end up getting hired by Cambridge Health Alliance because they develop such a connection with that system. They really love staying there and being a provider there as well.
You know, a lot of mutual benefit there for both the health system and the student's perspective, right?
And the patients.
Absolutely. Absolutely. We like to give our guests the opportunity before we close to offer up anything else that you'd like to speak about. If there are maybe a topic or two that we didn't have a chance to discuss, or if you just have some kind of parting words of wisdom, we'd just like to open the floor for you to give us some final words.
I was going to say, for me, when I went into PA school and graduated PA, I never thought that necessarily, I shouldn't say never, but going into education wasn't necessarily the first thing that I was planning on doing. Part of the reason why I went to PA school was so I could get out there and start helping patients. But the more time I've spent as a provider, the more I realized how important it is to give back to the PA students and to graduates and really training. And I don't think it's for everyone. Not everyone, I think, wants to have that same opportunity to teach others. But I do think when we were talking about shortages of rotations, for example, OBGYN, I think it's something that all of us as providers really have to remember, that there was a provider at a rotation that gave us a chance to see our first birth or see our first open heart surgery. And I think it's something that we all need to remember if we want to help end these areas with limited providers. We can only put more providers out there if they get that hands-on experience.
I think that's a wonderful point. It is really important to give back to the community in that way. And you're right. We all remember You're nodding, Stephanie, because we all remember those experiences as students that made us decide to do whatever it is we're doing now. Yeah. I think the thing I would add is for applicants is they really carefully think about their personal statement and any supplementary questions that we ask, not for just our program, for any program. We use those personal statements a lot to really get to know the person. And we understand you're driven by medicine, maybe by an experience or something that you saw or a family member did, or maybe a personal injury or medical issue that you had. We really want to know more about you. What is it that makes you? What makes you different? What other things have you thought about and maybe discarded in terms of a career, and why? And so spending time really carefully crafting that to make it you is really important to us. And I think to most programs too, because that's the only way we get to know you as a person. Otherwise, transcripts are transcripts. But this is a really great opportunity for us. And we read those really carefully.
Yeah, it sounds authenticity is an important aspect of that for you when you're taking a look at them so that you can make a well-informed decision about the people that are coming into your program. Thank you, Susan and Aliza, for taking the time to share about Boston University's program. It's delightful to have you on, and I'm sure our audience will be excited to learn more about your program, and we'll be flooding to your website soon.
Thank you.
Great. We look forward to it.
We want to thank our guests, Dr. Susan White and P.A. Stern, for their time and insights into the Boston University Chobanian and Avedisian School of Medicine PA program. We want to say thanks again to our episode sponsor, the PA Education Association. Tune in next time as we speak with the leaders of our profession, both nationally and worldwide.